gonna start palpating the bicep brachii. So in order to do that, you're gonna have your partner sitting with a dumbbell, it's easiest to see it, and you have them flex their elbow. With that, their bicep brachii should be about right here. It originates for the short head on the coracoid process of the scapula, and on the long head of the supraglenoid tubercle of the scapula. It inserts down on the tuberosity of the radius and the aperoneus of the bicep brachii. It flexes the shoulder and the elbow along with the supine of the forearm. Alright, so now you can have your partner set down and down. Now we're going to move on to the deltoid, which is the cap of the shoulder basically. So for this, it abducts the shoulder, and for anteriorly, it will flex, medially rotate, and horizontally adduct the shoulder. Posteriorly, it will do opposite. It will extend, it laterally rotate, and horizontally abduct the shoulder. It originates on the lateral 1/3 of the clavicle, the acromion, and the spine of the scapula. It inserts down in deltoid tuberosity. So if you were to apply pressure, like resist them right here, you should be able to see their deltoid muscle kind of pop out a little bit right here. Now we're going to go to the coracobrachialis. So you have your partner lay on their back. On their back. And then you will take their arm and have them flex it. Flex your arm, your elbow. With this, it flexes and adducts the shoulder. It originates on the coracoid process of the scapula. Its insertion is the medial surface of the mid-humeral shaft. So how you palpate this is it's basically like your armpit a little bit, and you will have them move their elbow. We'll have them try and resist their elbow moving toward their body. And as they're resisting, you see this muscle pop up right through here. All right, now you're gonna have them lay on their stomach so you can see their tricep brachii. Their tricep brachii, for the all heads, it extends the elbow. For the long head, it extends and adducts the shoulder. Okay, and then it originates for the long head on the infraglenoid tubercle of the scapula. It also has a lateral and medial head. The lateral is posterior surface of the proximal half of the humerus, and the medial is posterior surface of the distal half of the humerus. It inserts in the ulcerine process of the ulna. So in order to palpate this, as they're laying on their stomach, their arm is hung over the bed, and then basically all these muscles right here, right through here, are the tricep brachii. So if you have them kind of like flex their elbow a little bit, bend their elbow, which is flexing your elbow, and you have them a little bit resist, push up, you should kind of see some of those muscles like appear right through here.